Okay, good morning, everybody. So my name is Margaret Libby, and I'm with Mission SF Community Financial Center, which is the partner that Pollock was describing, that we work in partnership with Single Stop to implement the program that Pollock was describing. So I'm going to sort of dig down a layer, excuse me, and describe a little bit more in detail about the program as it works between the clients and the coaches. Excuse me. So Mission SF, our mission as an organization is to build community and individual wealth. We're a partnership between a nonprofit organization and a community development credit union, and we're one of about 10 of those such partnerships across the country. So we're really trying to pair financial education and financial counseling directly with the financial products that are designed to help low income and low wealth people get on a path to financial health and financial capability. So these are the four core wealth building strategies we use. And so when Single Stop approached us a couple of years ago to become the local partner to work with them closely on their financial coaching and counseling program, it made a lot of sense. It was really well aligned with what we're trying to do as an organization. So we were excited to come on board. This map is just to give you a sense. As Pollock said, the Single Stop works through community-based organization partner sites as well as community college sites, and many of the locations of the sites that Single Stop has chosen are in these areas in San Francisco that you see with where there are more red dots concentrated. This map actually was developed by the Fed, right, Laura? You guys, yeah. So for Bank on San Francisco to illustrate where there are more, where their banks are and where there's less access to the mainstream financial services that folks really need in order to get on a path to financial health. So I just wanted to provide some context in terms of where are we drawing clients from and what are the kinds of barriers to accessing quality financial services that they face. So a little bit of information about the client population that we're working with. It's folks with really limited incomes. I would say it's extremely low-income folks and low-income folks. So we are targeting, I would say, a different population, or there's some overlap in the population that we're working with and that EARN is working with, but we're really you'll see in the green box some of the personal characteristics and barriers that clients are dealing with that make it even harder for them to achieve financial health. So in addition to low incomes, limited savings and assets, in most cases none, either a lack of credit history or really impaired credit history, we're working with folks who are just exiting the prison system. We're working with homeless mothers, folks who are community college students, people who are transitioning into the workforce. In some cases, they haven't participated in the workforce, so it's a new thing. In other cases, people are moving from a field to another field. But these are some of the characteristics of the clients that we're working with, just to give you a sense. And I'm sure these are similar client populations to some of the folks that you all are working with. So in terms of what we're trying to achieve with the clients that we're working with in partnership with Single Stop, Schwab, and Mission SF, is these are the 5 key outcome areas. And these probably look familiar to you all in terms of the kinds of things you're trying to achieve with your clients. So on credit, we're trying to help people improve their credit scores or actually get a credit file if they didn't have one previously, to either reduce their debt or at least to kind of get a handle on what their debt is and begin to manage it. In terms of budgeting, to have a budget and not just to develop one, but to really figure out ways that they can build that into their daily life and kind of develop a budgeting habit. With savings, as Pollock mentioned, I think a lot of the folks we see feel like saving is not something that they can do, but we want people to develop saving practices, even if it's a small amount of money, to have that sort of regular routine or practice, and ideally to have an emergency fund. That's sort of the more concrete outcome there. And then with banking, to have an account with a mainstream financial institution. About 25% of the clients that we see are not banked when we first see them, and so we are engaging a lot of folks in accounts. So this is sort of, so you have a sense of who we're working with, what are the outcomes that we're trying to achieve with them. This is sort of the process of how a client comes into the financial coaching counseling program. And so you'll see that, as Pollock mentioned, the benefit screening is sort of off to the left, and that the site coordinator, who is sort of the key single-stop person at all of these local sites, is sort of their role is encapsulated in the red box there. They're really the person that introduces the client to what financial counseling is, what are the benefits, sets the expectations that this isn't something that we want to do like a one-time session. It's really something that we want to have people engaging with three and four sessions to really set those expectations up front. The other key piece or key role that the site coordinator plays is to do an intake, which is the really critical information for the coach or the counselor so that they know what kind of life circumstances, what kind of situation a client is in before they walk into that first session, so that they have time to do some research and do some preparation. As Pollock mentioned, if the case is a little bit more complicated, it goes to the Mission SF financial counselor. If it's something that's a little bit more straightforward, it goes to the coach. And then we go into the sessions, which I'll get into next. So this is really to lay out the framework of how we approach the work with clients. The first thing is, and I think this is really similar to what Emily described, is meeting the client where they are and really letting them drive the process. And so in addition to finding out more about who they are, where they are in their life, what some of their bigger picture life goals are, we do a financial health assessment, which consists of these four areas, which are related to the outcomes that we're trying to achieve. And we want to then find out, where does the client want to be, and then what the coach and the counselor do is figure out what are the action steps that a client needs to take in order to get where they want to be. And I think the key thing here, and it's sort of a theme that we've heard with the other speakers, is that it's really critical for the financial goals to undergird a personal goal or a life goal, because I think on their own, just cleaning up your credit isn't really a very exciting thing to do unless it's tied to something like, I'm going to access better housing because once I have a better credit report, I can get into a larger apartment, or I can start saving for that down payment, or it's going to give me access to a field that I currently face a barrier to entering into because of my credit report, given that employers are, I think, as you all know, increasingly looking at credit reports. So we really try to make sure that the financial goal is tied to a personal goal, and then make the roadmap and hopefully engage the client enough in that first session that they're coming back, and we can sort of continue to refine the plan as they go. This is sort of what are the resources and tools that we have that we utilize in the program. Once we have the client participating, we have the two full-time Mission SF financial counselors. We have 12 volunteers total right now in the program, and that number has changed as we've taken on new sites. 11 of them are Schwab employees, and we're trying out one community volunteer to see how that works to bring together both kinds of volunteers. And we have 7 single-stop site coordinators who are positioned in the different sites that Pollock and I described. We've gone over a few of these things, but I guess one of the things that I want to sort of pinpoint is one of the ways that we're increasingly thinking about framing this to clients so that we can do even better work around setting expectations is almost to think of financial counseling using like a healthcare model, to say that if you haven't been to the dentist in a little while, it's going to take a few sessions up front to kind of get everything where you want it to be, but then we want to see you on an ongoing basis. It's like you go back every 6 or 12 months to get your cleaning. Hopefully maybe you've done flossing if you weren't doing flossing, between the last cleaning that you had. But building in those action steps so that people really think of this, okay, I get it. It's something that it's going to be a little intensive on the front end, and it really is an ongoing process. And so to sort of support that, we've integrated these session reminder cards. We have a client folder so that somebody sees that we're really keeping track of their information and kind of treating this in a sense like something like a healthcare sort of model. And Pollock mentioned some of these other things, so I will move on to what a session might look like. And I think where I would describe I would say more of the sessions that we do through this program are more like counseling, because we really are seeing a lot of clients who are coming to us with a really pressing, urgent need. So, for example, we've had a client who came in who needed something removed from their credit report because they couldn't access housing. Living in a shelter, they weren't able to make, or they were threatened with losing custody of their granddaughter. And so for them, they really needed credit counseling. They really needed to get that item removed from their credit report so they could access housing. And so we see a lot of people who are in a really pressing, really urgent situation like that. And so I think what we'll do is, some of these steps here are steps that the coach or the counselor will take initially, hoping that once we get through that initial sort of more crisis situation, we can shift to, okay, let's look at a budget, let's look at some of these other more coaching pieces. But I think it really is driven by what the client brings to that first session. So as Pollock's data points showed, most of the clients that we see, probably about 70%, are coming because they want to do something related to their credit. So we review the credit report, address negative accounts, dispute errors, negotiate with debt collectors, all the things that you see here. And then with some clients in the points that are up there in orange, if we feel like people are clients who are able to really work with us in a long-term way, once we've kind of cleared away the initial bigger issues, and they appear like they could get they're in a position with their life circumstances where they could get a credit builder loan, and they're in a good position to remake, or to do the repayment. We'll connect them with credit builder loans and do the credit score pull that Pollock described, which is going to be a really powerful way. We started doing that in the spring, and it's been a really powerful way to engage clients who are ready for that. And I guess given our time, I'm just going to jump through. Budgeting is another topic that we focus on quite a bit. So in terms of lessons learned, this first one is sort of, I think we've all been in partnerships. You know that good communication, especially when you have a lot of different people working on a program, has been really important. The second one, we've already alluded to, that client circumstances and needs really need to drive the approach. So whether we're coming at it from a coaching or a counseling perspective, it's really driven by what the client's circumstances and needs are. The importance of the work being ongoing, I think one of the things, we've found our average right now in the program is that clients are participating in about 2.2 sessions, which is an improvement from the beginning. And of course, there's some clients doing more sessions than that, but we're really trying to get clients to come back over and over again so that we really can do the work. For example, so this is Diego Pinto, who's one of our financial counselors at Mission SF. He was the person that worked with Paul in the video, and I think that was the work that they were able to do together really did take 5 or 6 sessions. So to get those kinds of client outcomes, you need, it takes time and it takes multiple sessions. I'm going to jump. This is the lesson on evaluation. I think it takes a lot to figure out what tools you do want to use to measure the outcomes, because I think Pollock's already sort of raised some of the challenges there. But we've found that the data that we have been able to collect has been really valuable in motivating the volunteers to do their work, to motivate the partners, but also to really pinpoint what are some of the program challenges we have. For example, with no-shows, we're able to say which sites are experiencing challenges there, what are some of the things that we can implement to really improve the rate at which clients are showing for sessions. Given our time, the importance of versatility, having coaches that can speak different languages, that can do cross-cultural work is really important, because in terms of the ongoing nature of the work, there's so much that happens in the first session. It's so critical to do the relationship building, to engage the client, to keep the client motivated, to make sure that they feel that you've acknowledged the huge step that they've taken just in actually showing up to the session, that those relationship building skills are so important. And so we found that really, and actually I think I talk about this a little bit more here, is that we almost feel like the interpersonal skills, the cross-cultural skills, the language skills they're equally important, if not more important, than financial skills, content skills, because it's really about the relationship building that engages the client in an ongoing way so that you can have the continued sessions and continue to make progress on the outcomes that we're trying to achieve through the program. So I think that was the last lesson that we went. Okay, so with the last 30 seconds, that the other piece that I wanted to mention, so Mission SF has a financial counseling program that we offer on site in addition to the work that we're doing with Single Stop, where we have community volunteers that conduct bilingual financial counseling sessions. And one of the aspects of this program that I think I alluded to earlier is that we're able to pair the financial counseling with a credit builder loan. So for people who are in a position to get a $300 share secured loan that they could pay off over 6 months to build a new positive line of credit, it's a program that enables them to do that, and we can do the TransUnion credit score poll that we mentioned earlier. So it's another resource out there for those of you who have clients that may be in a position to get a referral to a program like that. So thank you, and that is it for me.